So welcome to the members of the media, our board chair, Menso Case, our colleagues and friends from the University of Rochester Medical Center, Dr. Mark Tauman, CEO of University of Rochester Medical Center and Dean of the School of Medicine and Dentistry, and Mr. Steve Goldstein, President of Strong Memorial Hospital and Highland Hospital. I am so pleased that you have joined us for an important announcement. We are proud to share that Finger Lakes Health becomes Your Medicine affiliate on August the 1st of this current year. Finger Lakes Health is joining the University of Rochester Medical Center, formalizing an affiliation process which has been in progress for more than 3 years. However, the collaboration between the two organizations dates more than a decade. Most recently, Finger Lakes Health has benefited from a close working relationship through a management service agreement that has resulted in an increase of medical specialty service locally, increasing access to care to our communities here in the Finger Lakes. Enhancing access to care locally is our top priority and was the guiding objective of our board when seeking a partner. We're proud to join the University of Rochester Medical Center, a center of research and a health system with a reputation of exceptional innovation, quality, and safety. Through this connection to one of the nation's leading academic medical center, we build upon our established clinical partnership, increase access to specialty care for our residents, and enhance our ability to serve patients and families for generations to come. This affiliation is a natural step in the progress from our organization's humble beginnings that started in 1880 with a community member depositing $7 on a local bank. Could you imagine? $7? And through the support of the community, Geneva General Hospital was established in 1892. A quarter of a century later, through the support of an entire community to honor residents that served in World War I, Soldiers and Sailors Memorial Hospital was built. For more than a century, we have expanded services to 4 counties. Those are Wayne, Seneca, Yates, and Ontario. We have many primary and specialty practices serving those communities. We have 4 nursing homes with specialty care units, such as neurobehavioral and Alzheimer's unit. Before the population health term was coined, and before the social determinants of health were brought to the forefront of medicine, we were already meeting those social determinants with providing our elders with independent housing at our 2 facilities in Geneva and Waterloo. In addition, child care has been provided by Finger Lakes Health for more than 30 years through our James Jean Dooley Center for Early Learning. In addition, for 65 years, we have a School of Nursing, and since 2008, we have a College of Nursing. In 1998, Soldiers and Sailors Memorial Hospital and Geneva General Hospital came together to form Finger Lakes Health. With it, an ambulatory surgical center was built, as well as 2 urgent care centers. So you can see the natural step and progression towards keeping local access was and is to affiliate with the University of Rochester Medical Center. You may ask, what has this partnership brought to the Finger Lakes? Well, a University of Rochester Medical Center nephrologist provides care to our inpatient and outpatient dialysis. The University of Rochester Medical Center cardiologists provide the ability for us to have The emergency room covers 24/7, 365 with the assistance of our own cardiologist. We have expanded telemedicine to support our stroke center, as well as telepsychiatry. More collaboration exists, and enhancement of urology, ophthalmology, and ENT. But I want to share something else. As individuals, we may go through rough times, tough times. And through those times, you know who truly is a friend. Those that come to your rescue to rally for you, or those that run away. Through the pandemic, we all went through very difficult times. So did healthcare organizations, as you all know. And during those difficult times, especially at the beginning, the steadfast resolve of the University of Rochester Medical Center towards Finger Lakes Health has been greatly appreciated. Every time we asked for assistance, assistance was given. That galvanized and cement the relationship and the future of our two organizations. And I want to thank Dr. Tauman and Mr. Goldstein for their support. And now I would like to introduce the board chair of Finger Lakes Health, Mr. Menso Case.
I get to adjust it. Here we go, there it goes. All right. Well, thank you, Dr. Acevedo. It's a privilege to serve as the chair of the Finger Lakes Health Organization, and I've learned so much from many of you in the room. It's been, I don't even know how many years, I've worked my way through several committees, and I've gained quite an understanding, very limited understanding of what goes on in a hospital, management group, our board of directors, for their foresight in considering affiliation with another organization such as URMC in a time of strength, but with a clear understanding of the challenges that we would face as a medical service provider and the need for having additional services that we can do through URMC, but also maintaining that the services here in the Finger Lakes, particularly in the counties that Dr. Acevedo mentioned. There's not a lot of us in those counties, and it's getting very difficult if we were to see someone like Finger Lakes Health disappear. We would lose so many services, and it's just not good for the community. So I commend management and the board in their efforts to find a partner. The process, as I look back on this process, included not just the management team, of course the board, but we also had many of the individuals serving Finger Lakes Health and all of its subsidiaries involved in the process. Their feedback was definitely an important part of the process. And I, as a business person in the community, I've seen many other ways that mergers and affiliations happen, but this is one of the best because we really listened to the need, and after careful deliberation, we looked at several other potentials, and we came down to, frankly, the right partner for Finger Lakes Health, and that's URMC. With their expertise in so many areas that we're just not able to provide, I think that we're going to see great enhancements as we go forward. My family and I have taken advantage of URMC services for years. Not that I'm real happy about it, but when the need's there, I know my cardiologist, URMC. I don't know what the other guy's called, but he's URMC. And there's so many others that have consulted in just treating my family, and it's been a tremendous success. Here I am kicking still, so it must be good, right? The affiliation is positive. The affiliation will maintain jobs. The affiliation will expand services, and overall, it's the right thing to do. And URMC is definitely the right affiliate for us. So without further ado, I'm so happy to introduce Dr. Mark Tubman to share his views.
I got to take this back down. One of the reasons we're affiliating, we're the same size. So, again, thank you so much. And this really is an exciting day. This is something that's gone back quite a while. We really thought we'd be affiliating sometime in 2019 when COVID came along, but it actually gave us the opportunity to work together virtually every other week. We've been having phone conversations so that we can make plans to do things that we really weren't able to do or aren't able to do until there is affiliation. But I think the question is, why is this so important? And not only important for the University of Rochester, but for Geneva and for the region. We really have, as an academic medical center, two overriding goals. One is that we provide state-of-the-art care, cutting-edge care for any disease imaginable, so that you never have to leave the region to get this care. But that really represents maybe 1 or 2% of care. For the rest, we would like that to be one, high quality, in which people can get that care as close to home as possible. And in the case of Finger Lakes Health, we're already talking about a very high quality healthcare system. And so by supporting Finger Lakes Health, by developing programs here, this is really a win-win. It expands the ability of people locally to get care for virtually everything, but it also, by building programs locally, allows us to open up beds to take transfer for those patients who cannot get cared for anywhere. Right now, we run at over 100% occupancy at Strong, at Highland, and we're turning away maybe 50, 60 patients a month whom we can't take care of because the beds are full. So it is very important for us. It truly is a win-win by building programs locally in Geneva and expanding the scope of what can be taken care of here. It's great for the people of Geneva. It's great for this hospital. It's great for jobs. And it serves that purpose of allowing us to accept patients that only can be treated at the University of Rochester Medical Center. We also believe that one of the challenges for healthcare in the 21st century is that more and more of healthcare is outpatients, and that puts a stress on the ability of smaller healthcare centers to provide certain specialty care that they might have beforehand. And so by having a system, by partnering with F.F. Thompson, we may be able to create economies of scale that will allow each one to cover each other, and for the whole to be greater than the individual parts, to create programs for which the scale of the two centers allow us to do it locally. So for us, this is incredibly important, and we feel for the region, we need a vibrant community, not just in Rochester, but surrounding Rochester. That's what attracts people. That's what attracts the best students and the faculty to Rochester, is having places like Canandaigua, having places like Geneva that are thriving, that expand the region. And we think by doing this, this will happen. So I'm thrilled that this has finally come to pass. There are a lot of things that we will be doing now that we are able to, that we've been planning for a long time. I would be remiss if I didn't mention my thanks to the New York State Attorney General for helping this to come to fruition, and thanks to Senator Schumer and Congressman Morelli for also working on our behalf to have this day. And I think I'll also end by saying that, you know, sometimes when you have these long periods of negotiation, you get to meet people and build relationships. And I think that aside from everything else, Dr. Acevedo, his wife, my wife, have become great friends. And so we were particularly looking forward to this. And that's sometimes the collateral positives of these relationships. So again, I'm just looking forward to working with Dr. Acevedo, working with the whole team. It's been great. And with that, I will introduce Steve Goldstein, who really has been a leader in developing not only our hospitals, but our overall strategy, which was important in this affiliation. So, Dr. Goldstein.
Thank you, Dr. Taubman.
Yeah, you can lift it again.
Yeah, we'll do that. Many of you may be aware that Dr. Acevedo is chair of the Hospital Association of New York, and that Haney's has been a very important organization that really looks at the way institutions around our state, and there are about 230 hospitals, work. And Dr. Taubman mentioned that the Attorney General's office was very cooperative in commenting to the FTC that our region and URMC has been very effective in developing alliances and linkages with community hospitals to really improve care for New Yorkers. And this is a really incredible time and a very difficult time for our hospital industry. There are about 6,000 hospitals in the United States, and many of them are really struggling to continue to provide services in a community and maintain fiscal and operational health. Throughout the industry, there are enormous challenges, particularly in staffing, from nursing, allied professionals, and physicians really of all specialties. Nursing homes have also been affected, and as part of the Finger Lakes system, there are roughly 400 nursing home beds as well. Staff shortages and reimbursement shortfalls have caused the closing of available nursing home beds in both urban and rural communities. And this has led to nursing home patients being backed up in hospitals. Emergency departments have been affected by this. As Dr. Taubman mentioned, our ability at both Strong and Highland to accept regional patients has been compromised as a result of the fact that there is a shortage in staff for nursing homes. And in Monroe County, we currently have about 800 beds that are not available to our institutions. And this backup has really created an inability of hospitals to accept new patients when the capacity has been exceeded, and has frankly provided fiscal restraints for both acute care and long-term care facilities. Inadequate reimbursement, supply chain challenges, inflation, and the changing demographics of our communities have all had a real negative impact on our industry as well. So the purpose of bringing institutions together in systems is really an attempt to counter some of these forces. By working together, we hope that these challenges can be addressed and that we can ensure that communities have the care that they require when they need it from practitioners who understand the needs of local communities. So today we congratulate Finger Lakes Health for its foresight to join us in this effort. It's often said that in order for communities to be really successful, they have to have at least three things. One is good education for their children, another is jobs for their population, and the third is health care for their community. Our focus over the next few years will be to ensure that Geneva and Penn Yan have the services that they need and the organizational structure that is both fiscally sustainable for decades to come. This is a terrific day for Finger Lakes Health, and we at the University of Rochester are incredibly proud to be part of it. Thank you.
The ever-changing microphone. So we have some time for some questions from members of the media as well as team members from Finger Lakes Health. Please.
Can you expand on how this will help with the staffing shortage, like you're saying?
Yeah, so as I mentioned before, we are doing some telemedicine. So that means we can have resources at a distance, such as from Strong, Highland, and other affiliates, collaborating with our teams on site, telepsychiatry, teleneurology, and others, so we don't have to duplicate the same type of specialties, especially when perhaps the volume is not there. Thank you.
Will we have babies born in Geneva again one day?
I will tell you that at this moment, the answer is no. And the reason is anything that has to do with procedures, you have to have the volume to create that competency. And through the years, we saw the volume decreasing exponentially. So we don't have enough volume to have deliveries at Geneva General Hospital. So it's an issue of safety. Thank you for the question. Other questions, please?
How many people does Finger Lakes Health employ?
1,300 employees at this moment.
And that gets added to U of R?
They don't necessarily become U of R employees. The model here is that this remains an Article 28 hospital, and most of them would remain employees of Finger Lakes Health. There might be some particularly new hires that might be employees of the U of R.
Okay, so Finger Lakes Health doesn't become part of it. It doesn't become UR Medicine or URMC.
Becomes part of UR Medicine.
Becomes part of UR Medicine, not URMC.
But just like the other affiliates,
Right, yes.
they have, many of the people remain employed by the individual entities. Right.
Okay, so there's a financial separation between
There is a so the bottom line is that the finances, the University of Rochester has a single balance sheet, because they own all of the medical center as well. They will roll up to the bottom line of the university. So when the university shows a budget, when UR Medicine shows a budget, Finger Lakes Health will be on it, including both their assets, their cash, and their yearly P&L. But they manage their own part of that, essentially independently, although certain things that have to be approved by the university.
Well, each of the organizations is in Article 28. Each has its own cost reports that it has to maintain, its own accounting systems that it has to account for within the organization that determine its pricing, its expenses, etc.
Go ahead.
Yeah. So
Yeah, I should have done that.
I'll raise the
There are multiple ways to design a system, and we've tried to be enormously flexible and responsive to local needs. Each of the organizations within URMC, and it's Jones Memorial Hospital, St. James Hospital, Nicholas Noyes in Dansville, Highland Hospital, Strong Memorial Hospital, Canandaigua, F.F. Thompson, now Geneva, now Soldiers and Sailors. Each of them is a separate Article 28 within the state of New York. And as a consequence, it has a reporting system financially that it has to maintain. It has to establish its pricing, its accounting, It has to report to appropriate regulatory. But as Dr. Taubman mentioned, the university rolls all of that up in the aggregate to simply understand what the needs are for each of the organizations and what their fiscal picture looks like. So we'll certainly pay attention to it, but the reality is that each institution is a separate Article 28. Any additional questions on it? Yes.
Soldiers and Sailors is considered a small rural hospital as opposed to the other hospitals. How will this affiliation with the U of R affect services at Soldiers and Sailors for that rural population?
Well, I will tell you, and Dr. Acevedo will expand. Soldiers and Sailors is a critical access institution. That requires then that it only has a certain number of beds, and it has a certain level of service. We'll work with Finger Lakes Health to understand what's required for that community and do what we can to make sure that we can provide those services if necessary.
If you don't mind if I-
Sure.
Yates County, which is county seat is Penn Yan, where Soldiers and Sailors is, has for the last quarter century been bucking the trend in New York State, where our population has actually increased about 25%, 20 to 25%, and industry has increased. And yet services at Soldiers and Sailors has contracted as that population has grown. Can there be any particular focus on seeing if those services can be expanded with this new affiliation?
Yes, so one of the initiatives is to continue bringing more specialty care at Soldiers and Sailors. Right now, the University of Rochester provides cardiology as well as we do. So following that trend, provide more specialty care locally so people don't have to commute all the way to Rochester. So that is part of the plan, and that's pretty much what this affiliation is going to do.
I just wanted to go back to Will's question for a minute, because, you know, while it is true that the individual entities, you know, have their own finances, the goal of an affiliation is to work together to make sure that all of the things that can be done, whether it's an expansion like you're asking or that makes sense, get handled. One of the things that will happen with this affiliation is that we will be working very shortly to bring the EPIC electronic medical record to Finger Lakes Health. And that is something that will be financed in part by Finger Lakes Health, but also in large part by the university, because that's something that would not be within the scope of Finger Lakes Health finances.
When you say bring the EMRs to what system are you on now, or are you not?
So right now we have 4 electronic medical records at Finger Lakes Health, which, as you can imagine, doesn't lend itself for many important things, such as bringing more specialists, because then they have to go through so many EMRs. So we have Meditech, Point Click Care, 2 of the 4 that we have. Ultimately, we want to have 2. Epic for both hospitals and all our practices, and Point Click Care for the nursing homes. Why? Because that is best of breed, electronic medical record, plus it communicates very well with Epic. So one of the scenarios that we have now is when we try to bring more specialists, obviously one of the frictions is, oh, but Finger Lakes Health doesn't talk to our EMR, and as such, we have to learn an entire new EMR to book patients, to do documentation. So it's an unnecessary friction for all these specialties, and as such, it becomes an uphill.
So that's a tremendous expense, isn't it?
It is a huge expense. that we're being helped by the University of Rochester Medical Center.
How many millions?
We're talking about upwards of $40 million.
It's, in case of Epic, it's always more than we think.
Oh, in case of everything. In case of everything.
And you can quote me on that.
Thank you.
Thank you. Other questions, please?
One of the particular needs in Yates County is at-home midwifery. We have a large Mennonite population who prefer to eschew medical facilities. Is there any midwifery program at the U of R that would address a desire and a large desire for at-home births?
Well, I can tell you that I have spoken to my colleague Mike Stapleton at Thompson, where they have OBGYN, and we have discussed services regarding obstetrics for Yates County. That's the extent of our conversation. We have not gone to the point of midwives, but we can explore it. I cannot give you an answer.
But just to clarify, we do have a large midwifery program, so this is something at the University of Rochester. So this is something that can be explored if, again, it makes sense in the context of the system.
In particular, at-home midwifery is desirable for this population.
As I said, we will discuss, as we've been doing regarding obstetrics for Yates County. It was brought to our attention by other community leaders, so the conversation already started. Thank you. Other questions? Then thank you for being here with us, celebrating our new partnership. Have a good afternoon, everyone. And if you need care, you know where to find us. Thank you so much.